Long after the Medicare open enrollment deadline, the questions for some people keep coming. Maybe you just had that big birthday or recently relocated to Houston. Those are reasons to join now or review or adjust your coverage. Joining us from Verda Health Plan of Texas are Jonathan Lemus and Christina Chin. Good morning.
Good morning.
All right. Having this conversation with a friend over the weekend, and still she kept saying, well, my aunt's going to probably move here, but she's going to need Medicare, Medicare. People still get that mixed up. So in this case, we're talking about Medicare.
Yep, that's correct, Medicare. And her moving and changing to a new service area, it's a good time to shop. You want to take a look at the plans that are available in that new area and find something that fits.
Yeah, and people are confused with that. They just think that Medicare is just this, the federal, it is part of a federal program, but they think that it's one size fits all. It is not. And that key word, you said find something that fits.
Right.
So it's the federal health insurance program for people age 65 or older and some younger people with disabilities. Okay. Yeah. The other thing that happens is that people didn't enroll by that deadline because they weren't 65 yet, but they turned 65 since then.
That's right. So that does open an open enrollment for them called an SEP, a special election period, and it lasts 7 months. It's 3 months before the month of their birthday, the month of their birthday, and even 3 months after. So they have time to really take a look at the plans and find one that works for them, right? Because they have different types of plans. At Verda, we have two types of plans. We have a regular HMO plan and then a chronic C-SNP plan to serve people who have a chronic condition like diabetes or cardiovascular disorders.
Yeah. So basic things like eyes, hearing specialist, general health care, and the coverage, of course, as you said, depends on your plan. And as we know, that coverage can change on a dime. It could just change at any time, can it?
Yeah, absolutely.
So, all right, because you need a new prescription, you could be diagnosed with a new disease. Okay, so Verda Health Plan of Texas, culturally focused Medicare health plan. So it has a unique kind of philosophy to it. Tell us how it got started and why.
Absolutely. So it was started in order to serve underserved ethnic communities. Perhaps someone speaks a different language and they didn't have the resources. Now with Verda, we have resources and we have folks who speak several different languages like Vietnamese, Chinese, English, and Spanish. Here in the area, we've been continuing to grow. We're in Harris County, Fort Bend, and Montgomery County, and now we're even in Dallas. Yeah. So for Dallas County and Collin counties. So we serve these ethnic communities, and we serve folks of all backgrounds, right? We want to be able to reach all these communities and get them all the benefits that they need and they deserve.
And especially here in Houston, the most diverse city in the country.
Absolutely.
And Christina, you're from a Chinese background, and so one of the things that's so important, you mentioned somebody either speaks another language or more comfortable in that language. And when you're explaining things like healthcare, we need to have the best understanding possible. So that's something that's important to you all.
Yeah, that's correct. Yes.
And you speak. Then there's several languages that will be spoken under your umbrella.
Yes.
All right. So you're communicating in the first language, and that's very helpful. You address those language barriers as we talked about, and you have diverse staff representation. They go through a cultural competence training.
Absolutely. We want to make sure everybody's aware and that they have the information that they need to serve our community better.
Yeah, all right. You have resource centers that are available as well. There's nothing like people being able to get together for interaction. Tell me what that's like.
Yes, we have a local resource center. It's built locally in Houston. So, like seniors, sometimes they are not need the medical resource. They need like the social content. Like they want to talk to real people, not just like people on the call. So that's why we built the resource center. We can give them a lot of events. They can hang out with the friends and also make new friends over there too.
Yeah. In fact, I think I'm going to go hang out with them. All right, no appointment needed. Which is good too, because sometimes that's a barrier as well.
Absolutely, yeah, no appointment needed. They can come by, and it's really important if somebody has a chronic condition, they can continue to make an election one time a year. So if somebody has diabetes or if they have a change in their health, right? If that changes, well, that may open an opportunity, and it's always good to reach out to us directly, right? Yeah. Give us a call, get the information you need, and we'll always be willing to help.
And when you say reach out directly, because that you touched on it right there. For especially a lot of older folks who are not used to the press 1 for, press 3 for, plus 4, because we're going to hang up. Okay, we're done dealing with the machines. But so you get to talk to somebody and ask your specific questions. And when we say that member resource center, you talked about getting social. There are so many cool things that they get to do. There's game nights, there's painting classes. And how do you see when someone first comes in how it affects their whole mood?
Because we already see some people, they are lonely, they're only by themselves, they have no kids, no family here. So the lady, she came to the office and make so many friends. So she liked like to come to the resource center every week to see her all new friends.
Yeah.
That's we can see, okay, we did the good thing and the better thing for all the older communities.
Yeah, and we saw, especially during COVID, how many people were living in isolation of all ages, but especially seniors. They have a tendency, because in America especially, kids have a tendency to grow up and move away, right? And so they're left alone and they don't want to bother anybody. But when you're not social, because we're social beings, it really impacts somebody's complete, mood and emotions and the whole bit.
Absolutely.
So having these options here, it also gives you a chance to, as they start to get out and get social, to be able to say, well, I'm having a problem with, we can address that. Just as we talked about a little bit earlier about being preventive, when you can jump on things right away, it can keep somebody healthier longer.
Absolutely. And them having a place that they can go to, that they can trust, and they can interact with other folks that are going through the same thing, right? Everybody's relating to each other and they're all a part of Verda Health Plan of Texas. It really helps to bring them together and get them out there.
Yeah, okay. I'm just looking down here. Tea parties, karaoke.
So much fun. Yeah, we
You
have
have
fun.
how old do I have to be to come up there? Right. Okay. Birthday celebrations, dancing classes, and you can bring a +1. Somebody out there, make me your +1 for the karaoke night. All right. When someone gets started, they're listening right now to get started. So is this if they are not with the plan, or if they are with the plan already, can they switch, or what are the requirements here?
Great question. So it's for both. If somebody's just getting started, Medicare can be very confusing. It's good to call and get the information to get some guidance. Right? Let's help you look up your medicines, look up your doctors, make sure that they're in the plan, and if it's a good fit, we'll go on from there. It's no obligation, great information, a great resource for them. Now, if they have a current health plan, we can absolutely, compare the plans. We want to make sure that it's a good idea. If their current plan is working better, then we won't make any changes at all, but at least they'll have a place that they can come to get their questions answered.
Yeah, and here's another issue here. If someone's calling you saying, hey, we can switch you, be wary of who you're dealing with. With you all, you're talking to a person on the phone that you can go in and meet face to face if you want to.
Absolutely.
So you know it's a real person, not somebody just trying to scam you, because there are those scams out there.
Absolutely. And we're licensed by the state of Texas to be able to go over this information with them.
Yeah, all right. Well, thank you all very much.
Thank you. Thank you.
Okay, Verda Health Plan of Texas has multilingual representatives, like we mentioned, ready to take your call. Give them a call at 877-419-2730. Again, that number is 877-419-2730, or visit them online at verdahptx.com, verdahptx.com.